Okay guys, I told you that the video will be in two forms. The first one and this is the second one. The first one we talked about a general information, general overview about breast cancer. And if you've not watched it, go back and watch it to get the full benefit of these two videos. Because they will be talking about the breast self examination and some of the preventions, some things that you can do so that you not be predisposed to breast cancer. So Mr. Osman, a demonstration of how to do your own self-examination. You know, if you have breast cancer or you are there's some changes in you.
Yes, when I was talking of the risk factors, I forgot to add aging. Yes, the breast cancer, like it increases with increasing age. I mean, when the more your age, the more your risk of getting breast cancer. So once you start growing up, you see that your breast will start getting some changes. Maybe it used to be flat. I'm talking of the ladies. But as you are growing, it will change in size. So it's very good that you do your own examination every month.
Okay.
At least every month you should be able to. But some of us even come from the school of thought. When you are bathing, that's every day. When you are bathing or you are dressing, just try to be massaging that area of the breast to be able to help. That's to help screen yourself. Just know your breast well.
Okay.
But this is how the examination is to be done. So the demonstration is very simple on how or what you can do to examine your own breast, to be able to feel, to be able to know whether there's something abnormal going on. Yes. What you do is that first of all, you stand in front of a mirror. You stand vertically straight in front of a mirror. Then you undress just your topmost part. So you stand in front of the mirror, facing yourself. Then you put your hands on your hips this way. Then you look in the mirror. You observe your breast. So in the mirror, you observe for so many things on your breast. You observe for reddening that I was talking of, the dimpling I was talking of. You observe whether there is some scratch or something, bulging, something, is it some, at a point of the breast, is some place raised than the other. You look for all these things by doing this and observe. You realize that when you are doing that observing, you will not be able to see the underarms. So the next moment, the first one I told you, stand in front of the mirror, you put your hands on the hips or by your side, then you observe your breast for any abnormal appearance of the breast. Then the next thing is that you raise your hand. When you now raise your hand above your head, you now look at the underarms. Is there some reddening that I was talking about, some swellings, underarms? You look at all those places. When you are satisfied that that place is okay, then the next one is you flex your head small this way, so that you want to check the collarbone area, like you flex yourself small to feel is there some feeling of uneasiness around the side. If it's not there, then you now lie flat on the bed. You can't do that. So when you lie flat on the bed, you put a pillow under your shoulders to raise it up. Then you use the right. If you are using the right hand, that means you are going to use it on the left breast. You are now going to, then you use 3 of your fingers. And the fingers, you are not using the tip, but the pad of the fingers. So you can use this way, you can use this way. And use the pad to now be feeling the breast. Because now you are on the bed, there's a pillow under or a folded material like towel. Then you use your hand, I mean the pad of your fingers to now go through. And you do it starting with lightly, medium, and then firmly. So you can just start. It depends. The most important thing is that every area of the breast, you should be able to feel it. So you can start by just touching it lightly and going medium, then deep. Then you press. When you press, you are trying to feel whether you can feel any lump. So you can go in a circular motion, you can go in rolls, or you can just go that way. To make sure that every area Because when you don't do that and you do it gently, if not, you skip other areas of the breast without actually touching it or without doing it. And sometimes one easiest way is that even when you are bathing and your hand is very soft, the soap is there, you can do it even very well in the bathroom. Yes, so you use your hand, you full around all your breast, all the parts. But you even try to, the nipple, you try to squeeze it and see whether the fluid, some fluid, there may be a fluid, but if you don't squeeze it, it won't come. So when you squeeze and it comes, you look, you check, is it bloody, is it yellow, is it watery, and all that. Anything you see, you make sure that you quickly see your doctor and inform him that these are your findings. So the doctor will pick it up from there.
Intensive. That's really the demonstration is really a lot of work. So I just want to ask you a little thing again. Do we do it after our menstrual this thing, the monthly menstruation?
It's advisable you do it after the menstruation. When your breast has gone back to normal and the things are okay. Because when you are menstruating or getting closer to menstruation, because of the changes, it may affect the weight of the breast and there may be some changes. Because of the hormonal changes, so it affects the breast. Definitely, when you do that, it will give you a wrong information.
Okay, and you talked about dimpling. I just want to ask for my people. Someone might not understand dimpling. So when you say dimpling, what do you mean? Dimpling of the breast?
Yeah, dimpling of the breast. That is like, for instance, when you press on it, it creates a hole. Or maybe like when we look at dimples, how dimples are. It seems to have
like mine.
Or the speakers have it. So when you have so when there's that hole, there's a skin surrounding and then there's a hole in the middle. That's called a dimple. For instance, when you even dip your finger on the breast and then it goes down, it doesn't quickly come up, but it forms that hole. That's the dimple.
Okay. And you talked about the self-examination. It's all about massage, so you can let your husband do it for you.
No, it's okay. It's good you bring it to the hospital and do it.
After this thing, if you see any changes,
you said your husband,
if you see any changes, if he does it and you see any changes, you can send it to your hospital.
In fact, there's even something now. Prolonged breastfeeding is good, like in preventing
breast cancer. Okay.
It has come out that when you let the child breastfeed, you don't stop him after 6 months. You just like most people do. We say that give only breast milk for 6 months, but after that you can introduce. But most people, when the 6 months just come, they'll start introducing and stop the breastfeeding. But what they don't know is that if they continue, it's better for them. Because just continue at least 1 year, just keep on giving the breast. Because we are helping to prevent the breast cancer. And once the child's own is done, the father too is for him. So let him, so that we prevent breast cancer.
Okay, yeah, advocating for men here.
So it's for them, it's a property for them.
Okay, so I'll not go there. Okay. So let's talk about the prevention here. What we can do to prevent it. Some of the risk factors.
So very good. You talk of the risk factors. So you just turn the risk factors they are into, then they become prevention.
Okay.
As I talked earlier on, you turn the risk factors into prevention. So, example, exposure to radiations is a risk factor. So try to avoid it. Avoidance of radiation. Or try to put protective clothing so that so much radiation don't come. Yes. We talk of the early detection. Every month, try to do your own self-breast examination every month. And when you immediately come out with anything abnormal, then you go to the nearest health facility for checkup. It's very good to help prevent it. Then we talk of alcohol. Avoid the alcohol because nothing boosts cancer from alcohol. That's the truth. Scientifically, nothing boosts cancer. So you avoid it. You avoid tobacco or smoking. So when you avoid it, then you are helping to prevent. Then I talk of the prolonged breastfeeding. And we encourage it. Prolonged breastfeeding awareness, like what you are doing. you try to create the awareness of people. A lot of people are going with those lamps. They don't know. We want to prevent it. But once you educate them, health promotion, you educate them and you let them know, you create the awareness, they quickly come. And mind you, when the lamp is early detected, then the prognosis are good. When I say prognosis, the outcome of the condition is good. Because when you early detect the lamp, then you can put on measures to treat it. You can go in for the surgery. When they quickly see in the lamp, then they check, is it benign or malignant? We have two types of cancers. We have the ones that are just localized. They don't spread. And then we have the malignant ones. That one is spread. So when I was talking of cancer, even when you come and then they detect the lamp in your, there are so many, like let me talk of the laboratory investigations they do to come out and know that this is actually a cancer. We can do the mammogram. So maybe when you do your personal breast examination, you find a problem, you send it to the hospital, they will do mammogram. The mammogram will help to also detect, but the mammogram is not reliable. So they may take a tissue from the breast. It's just a biopsy, tissue biopsy, and go and check the tissue and see whether it's cancerous. And so what all that I'm saying is that the earlier you bring your condition to the hospital, the better. So once you just find anything abnormal, then you bring it to the hospital. Quickly it is taken until you are free. So once you come and then, in fact, a lot of people are very scared. But the good news is that once you detect it early, then they combine surgery, radiotherapy. Yes, I talk of radiations, but actually radiations can also be used to kill the cells. But this one is controlled, it's medical, so they know how to chemotherapy, and then they combine all these three, and then quickly you are free, you go back to normal. But even in worse situations or worse scenarios, a lot of people think, I want to clear the misconception. Once you have the most important thing is that you bring it. So don't be misguided that when you have breast cancer, your breast will be removed. There are so many treatment options that are available. Once you detect a lump, you send it to the hospital. Abnormal discharges from the breast, quickly send it. Reddening of the breast, dimpling, thickening, all this quickly rush to the hospital. Please, it doesn't mean that you have it, but just send it. It may be a cyst. You know, we have conditions we call fibrocystic conditions. So it may just be a simple thing. It's not, but just send it. You want to protect the breast because it is very valuable.
Okay, so we've talked a lot about breast cancer. It really shows that breast cancer is a big issue and it's claiming more lives. And as you said, early detection is very good for treatment. If we detect it earlier, they can protect you, they can treat it very well for you. So what I want to urge you to do is that after watching, share with everyone you know. This one is for you to protect other people. Share with people, especially the aged people, our mothers, our sisters, all of them. You have to share with them. Our brothers, you are not left out. Breast cancer can also affect you. So you have to share with everyone you know for them to get the information. This is just creating awareness. And this month is October, Pinktober. So you have to go to the hospital. They are doing a program at TTH. There's free screening for you. So you can go and screen yourself free of charge to know if you have breast cancer or not, so that you can protect yourself earlier. And if you have, you can arrange for treatment. Okay, so if you enjoyed the video or you got anything out of it, kindly consider subscribing, commenting, and just share with people to help this channel. See you on my next video. Bye bye.